The Susan Leslie Clinic for Neuroendocrine Cancers was started a few years back by Dr. Law and myself. We both had an interest in neuroendocrine cancer, and we soon realized there really wasn't a great place for patients to go or a center with expertise. So we decided to create a clinic that we envisioned to be multidisciplinary, where patients could go and receive all the care they needed for neuroendocrine cancers, hopefully in one spot. Since that time, it's really grown quite a bit. We now have expertise with surgical oncology, medical oncology, radiation oncology. We have endocrinology in our clinic. We have psychiatry and psychosocial oncology in our clinic, as well as nuclear medicine, radiology. And what we've really added has been a lot of elements of supported care, social work, pharmacy, dietitian. We really tried to look at all aspects of patient care in the clinic. So when we're making treatment plans for patients, the first thing that's really important is to involve the patient, to understand what their priorities are, what they want, and what works for them. The thing about neuroendocrine cancers, it's a wide variety of diseases. It's actually not one type of cancer. So we really want to find out as much about the disease as possible, and as I mentioned, about the patient as possible. And then with a multidisciplinary team, we often have a consultation to realize what role each of us can play, and what's in the patient's best interest moving forward. The last few years have seen a number of new drugs really be developed for neuroendocrine cancers. By far the most common treatment is an injection that patients would get once a month. From a side effect point of view, it's usually well tolerated, and sometimes patients can be on those treatments for even years, and it can, without progression of their disease, or that means that their disease doesn't really grow, keeps it at bay. There are oral therapies, which mean pills that you can take every day. Some of them have some side effects, but we're quite good at managing them now. And then there's IV treatments that are being developed, new chemotherapies and even old chemotherapies that sometimes work at being able to help control the disease and sometimes even shrink the disease. New treatments are coming along in terms of what we call systemic radiation, which is where we actually inject radiation into the system to try to target the cancer cells. And that has been showing a lot of promise lately. There are some side effects from treatment, and of course we try to manage them. The most important thing is communication. We need to make sure we have good two-way communication with our patients, so both that we explain to them what side effects they might experience, they can be on the lookout for them, as well as that we make sure that they tell us when they feel side effects early so we can help manage them.
The role of surgery in neuroendocrine tumors can really be focused on two major things: diagnosis and treatment. So surgeons are there to help you figure out what is the problem, where is it coming from, where is the primary tumor, and give you an overall sense of what the staging is, and that will help you develop the plan, which obviously leads us to the next part, which is treatment. Surgeons are an integral part of neuroendocrine treatment. Not all neuroendocrine tumors can be treated by surgery, but many times, whether it's in one spot or whether it's in many spots, the surgeon still has a role in helping you reduce the amount of neuroendocrine disease or remove it entirely. Patients undergoing surgery for neuroendocrine tumor should have some questions to ask before the surgery. Instead of going through a list, let me give you some general principles. The first thing is about the surgical choice itself. Make sure you understand why you're having surgery and what your other options for your treatment were. So if you've made a good decision, or you know what's happening and you understand why you're having your surgery, then I think that part's really important. The second is, make sure you understand how your family and your loved ones are part of your care. That is, when you're timing your surgery, you need to understand that they need to be there for you before, after the surgery in particular. But the important part is that when you set your date of the surgery, that you have a thoughtful process of how you're going to be supported in your recovery. The third general category is understanding how to prepare before your surgery. The answer is never sit at home and splurge on Netflix or whatever before the surgery. The key actually is, what do you need to eat? How do you need to get fit? What are the exercises you should do? There are actually important things that you should aim for preparing for your surgery in order for the surgical outcomes to be as good as they can be. Finally, habits, and bad habits in particular. So these are the last things you need to at least ask yourself about. Am I smoking too much? Am I drinking too much? Am I eating too much processed foods? Those kind of things, you need to ask yourself that, and if you need help, ask your surgeon or even a dietitian before your surgery to make sure that you've really made yourself as good as you can be prior to your surgery. So now you're at a point where you're after surgery, and there are other important questions to ask at this point. Now, obviously, give yourself a little bit of time after surgery to recover, but when that time comes to meet with the surgeon after the surgery, make sure you understand the following things. The first principle is make sure you understand what was achieved at surgery. Sometimes it is exactly as you understood before. Sometimes it's different. And it could be a good different, or it could be a different, but the thing is, make sure you understand what happened at surgery and what does it mean for your care, for your outcome, and for any other treatments that you need. The second general category is how you can help yourself recover as quickly and as steadily as possible. So the questions could be, when should I exercise? What kind of exercises can I do? What foods should I aim for and eat? Are there ways of eating that could help me recover? Or maybe there's ways that you should modify the way you eat or drink incompatible with the way the surgery went. I think the final thing is to make sure that you understand things that can happen after surgery. When should you ask for help? Are there little times where there might be a warning sign of some things that could be easily treated, but only if you can meet with your team sooner rather than later? Again, all related to making sure you have optimal recovery after surgery. The final part is to make sure you know where do you go from here. For our neuroendocrine patients, we always emphasize to them that the key to their overall treatment is actually a group or team approach, and it's never just surgery alone. So you've just had surgery. The question now is, what should I look forward to? What are our next steps? What is the next plan? And make sure you understand how that surgery fits into your overall plan. That way, everything connects well and we can optimize your care.
For patients with neuroendocrine cancer, there are varied reasons why radiation may be used, and it's dependent on the stage, presentation, and intent of treatment. And it ranges from being delivered to improve symptoms all the way to being very aggressive in providing local management both of a specific site of disease or potentially even using systemic radiation therapy. Generally speaking, we would be using radiation treatment for patients with symptomatic sites of disease, whether it be pain in bones or problems with breathing, where we would use radiation to shrink tumors. Another way that we might use radiation is in the setting of progressive local disease where we're able to deliver high doses of treatment. In that scenario, we might be using a technique called SBRT, or stereotactic radiation, where we're attempting to deliver as maximum a dose as possible to a tumor, but try to reduce the side effects to the normal tissue around. The final reason for using radiation therapy for neuroendocrine patients would be to use systemic treatments. The other name for this is PRRT, which stands for Peptide Receptor Radionuclide therapy. And this is a technique where a radioactive isotope is attached to a molecule which is injected intravenously, and in certain patients with neuroendocrine tumor, this may attach to those cells, and by doing so can deliver radiation therapy to all cells in the body that are expressing this receptor. And so dependent on the indication type of disease, radiation therapy has a very large role in the management of these patients.
So my role is basically to sort of see patients through their treatment journey and make sure treatments are safe with respect to the other medications that they're on, and also to manage side effects as they come up. If I was to say to patients, there are 3 things that you need to know from a pharmacist's perspective. I would say every appointment you go to, bring a list of your medications or bring the medications that you take with you, even better, because you never know sort of where each appointment will take you, and it's always really good to revisit if there are any changes and to make sure that we have an up-to-date list in our records, particularly if you're going to start treatment or change treatments. I would say the next thing I would caution people on, but actually encourage them to enthusiastically involve the NETS team with, is with respect to natural products. So we are constantly exposed to messaging with respect to alternative therapies or natural supplements, which is fine, and I think it's great that we explore these things together and make sure that we're all in the know of what you're taking, whether it be alternative or through a naturopath, so that we can make sure that we keep you safe on the treatments that you're taking. And I think the third thing I would want to make sure that patients know is to not be afraid to talk about how you're going to pay for treatments, medications, and sort of how to access the drugs that you need. So here at this clinic, we have a fantastic drug reimbursement team, as well as amazing social workers and myself at the pharmacy, who make sure, A, you have access to all the treatments that you need, and we navigate the various access pathways for you, whether it be through your insurance or through the government health plan.